Thanks for staying with us. A non-governmental organization, Project Pink Blue, has called for the decentralization of cancer control and treatment, which it says will help to reduce the deaths from cancer. The executive director of Project Pink Blue, Runcie, Chidebe, said this during a walk to mark Cancer Day in Abuja. Chidebe says a few cancer patients have access to treatment for the disease and that the cost of treatment is expensive.
We always say that early detection saves life. That is true, but the reality is that it's actually early detection and treatment that really save life. Because the problem is that there are so many gaps that exist in treatment. In the whole of south of Nigeria, there is no government-owned radiotherapy machine that is currently working. The only radiotherapy there is actually a private owned. So there's a need to close that gap. We currently have cancer centers in other places, but some of them are not working. Another call to action that we really need is that there is a need to decentralize cancer control. We are leaving cancer control only in the hands of the federal government. The state government need to take up action and protect their own people.
There's a very high rate of mortality in the low-income parts. We need to have more equity in the diverse populations of the world. Whatever your color, whatever your religion, whatever your sex, everyone needs to have equal access to cancer care across the spectrum, from awareness to palliative care.
I survived, I defeated, I beat colorectal cancer stage 3. And I want to tell you today that the essence of what we are doing is not someone like me. It's not for other champions. Champions is not for all of us. It's for everybody here.
Okay, let's now chat to Runcie Chidebe, who is the convener and executive director of Project Pink Blue here in Nigeria. A very warm welcome to Newsnight.
Thank you very much, sir.
Cancer.
Yeah.
Very frightening words too. I mean, universally and the rest. And in Nigeria, we only saw a few days ago on this channel, somebody was wrongly diagnosed and the rest. So the problem is even multifaceted, right?
Yeah, it's even getting worse as well.
Yeah, tell us more.
Okay, yeah, so in Nigeria, it's cancer is really not just a serious issue, but it's really a disease that we really need to declare state of emergency on.
It's not a serious issue.
No,
but
I mean, it's not just a serious issue.
Oh, it's not just a serious issue. I needed to get that clear.
Yeah, but we need to also declare a state of emergency to cancer. Because right now, we now know what we can do to really prevent and reduce the burden of cancer. But however, we haven't been doing it.
What are those things?
So we know there are some cancers that can be preventable. For instance, we know of of human papilloma virus is really linked to really causing cervical cancer. In Nigeria today, about 26 Nigerian women die of cervical cancer every single year. In fact, cervical cancer has been declared the disease of the poor. You know, the interesting thing about the disease is that some women could have cervical cancer and in 5 years, they would not even show any symptoms. They show symptoms when it's already late. Now, the federal government have a vaccination, which we advocated for over 3 years. And now the vaccine eventually came in on board. They have started vaccinating girls from 9 to 14 years in about 16 states, and they want to really expand it. And that's why we're really grateful in this work. We had Dr. Muyi Aina, the DG of National Primary Healthcare Development Agency, who mentioned during the event that the next phase will spread across other part of the country. Yeah, so this is really a very important milestone. There are also other issues. For instance, you know, hepatitis now has been linked to liver cancer. So many of us who were born after 2014, when hepatitis was never part of, you know, the routine immunization, it came in 2014. It means that most of us already are at risk of liver cancer because we never had that hepatitis vaccine. So it's really important people really take some of these simple steps to really protect themselves. while we are also protecting themselves to ensure the burden doesn't come, because the treatment facilities are not sufficient. They are not available.
And they're very expensive.
Very expensive.
No subsidy.
No. The whole of south of Nigeria don't have any government-funded radiotherapy machine. So most patients from the south, it's either they go to the private facility in Calabar, or they have to drive or fly to Lagos, or probably even...
I thought they have a center at the University of Nigeria, UNCH.
That is southeast.
Yeah,
that is southeast. The whole of south doesn't have. So there are so many gaps that need to be closed, you know. So, and that's why it's really important to democratize cancer control, to decentralize it. Right now, as it is, it's just in the hands of the federal government. We can't really make a lot of progress. Like many campaigns you see during this World Cancer Day is all focusing on early detection, which are great, but early detection and treatment is better, it's stronger, it's more relevant. If you detect early and you don't get it treated early,
the person is at the departure lounge,
yes,
as elder statesmen would say.
Yeah.
But let's look at funding too. I mean, we've talked about not having screening centers and, the therapeutic centers too, except very few. And the federal government is burdened with a lot of economic issues and the rest. So how can donor organizations help, and your organization, for example? Is it just the work for awareness and the rest?
Yeah. Thank you very much. So you see, the work that we hosted a few days ago was not just for awareness. It was also for advocacy, because we were spotlighting issues that people are not aware of, right? And then we're also bringing to bear the issues that the government need to know that exist, that need to be fixed. And then we're also raising funds. We have everyone wearing pink, blue, orange t-shirt. People bought this t-shirt and we're going to raise money and we'll use it to support some cancer patient. But the reality today is that this is not enough.
Which is more prevalent in Nigeria today? Breast cancer?
Breast cancer. Breast cancer, cervical cancer, prostate cancer. These are the three top leading cancers. Other cancers that are actually coming up now is also liver cancer. You know, and it's really important, learn colorectal cancer as well.
And how are you campaigning against organs harvesting that has now become very prevalent in the country? Some institutions taking advantage of the poverty situation of, ignorant people and harvest their organs for nothing.
Oh yeah, that's really a very serious...
It's happening in the Federal Capital Territory.
Yeah.
A top hospital is very much in that distance.
It's a very serious issue, and that's why it's really powerful to begin to educate our people to really understand patient rights. You know, patient right is something we don't talk so much in this country. Right? When people go to see their doctor, they don't even prepare. They don't even read. They don't even understand what exactly they want that need to be done to me. You were, a few minutes ago, you were talking about the patient.
Wrong diagnosis.
Wrong diagnosis.
Wrong diagnosis, right? And everything about her is come to a standstill.
Exactly. Her life has changed forever. You know, forever she's going to live her life without breasts and we don't even know what her fertility stage would be again, because she never even had the carcinogens of cancer in her life. So we need to strategically and more importantly be intentional to educate our people. Doctors are not God. They are just human beings, and there are bound to be mistakes. Healthcare workers need to be educated to allow patients to speak up.
Those are very costly mistakes. I've seen a friend who had malaria, wrong diagnosis, shots, given some jabs, and today she's completely impaired.
Yeah, and that's why we need to encourage patients to seek for second opinion. More importantly, when you are having diseases that are terminal, that could really impact your life forever. When you are getting a diagnosis for prostate cancer, breast cancer, cervical cancer. We encourage our patients. You know, I founded a support group in 2017 that we started with just 9 patients. Now we have about 17. And one thing I always tell the breast cancer survivors, prostate cancer survivors, and the people we work is, seek for second opinion. One hospital is not enough. If you ask this doctor, go and ask another doctor. Read, call us. We have a patient navigation phone. Call us, and we can advise, we can provide some support, and we can navigate you to places where you can get a lot of information. But while we as a non-profit, we're doing what we can, don't forget that we have limited resources. That's why it's so important that the government really continue to raise its bar. Because the problem about cancer, as I said, it needs to be declared a state of emergency, is that cancer is affecting people at the time we needed them most. When people are 50, 60, and they're beginning to be the future of the country. Imagine someone like Dora Akunyele when we lost her to cancer. She was already a minister, she was already going so high, becoming relevant. So the government need to begin to decentralize cancer. I can give you just one simple way we can really reduce this burden and find cancer early. For instance, imagine if we have a policy that says that once a woman is pregnant and she's coming to antenatal, right? That woman is mandated to do breast self-examination and cervical cancer screening. Believe me, we're going to cut down the screen. We're going to cut down late detection by almost 50%. We can do that by including cancer screening in basic healthcare provision fund.
Yeah.
It will be very... So these are just simple wins. Imagine state governments, for instance, setting up cancer institute in their different states instead of all looking at the Federal Ministry of Health. You know, because don't forget that Professor Patti, who is the minister, is also Minister of Cancer, Minister of Malaria, Minister of so many issues.
Okay, let's look at this disease, cancer itself. And
Yes.
a lot of people would say one way to checkmate it is lifestyles.
Yes, that's correct.
Which may include, you know, don't drink alcohol, don't smoke, check your dietary conditions and the rest. You don't have to have a buffet for a meal before you have a good and balanced diet, but it's good help too and the rest. I put all these together. It's don't eat this, don't eat that, don't do this, don't do that, you know. A lot of people get confused and the rest.
Yeah, that's absolutely correct, and I totally agree with you. But the principle is just moderation. There are ones that you really moderate, there are ones you can limit, there are ones you have to stay away from. I will tell you for sure that if the intersection between smoking and cancer and many other diseases, cigarette smoking and cancer and many other diseases, were discovered before now, smoking must have been made and embargoed. You know, like something that is totally prohibited.
What happens to the tobacco farmers and manufacturers and the rest? So put millions of people out of
So
job.
the reality is that we have to decide what we want to prioritize. Do we prioritize our health, or do we prioritize things that impact our health?
Isn't salvation a personal concern?
Well, it's a personal concern, but however, we need to understand the impact of this to our general population, to our economy. It's only a healthy person that can fix the economy. It's only a healthy person that can work to contribute to their family. Over 120,000 Nigerians are diagnosed of cancer every year, and about 78,000 die. So think about that and match it up with people who are fueling this disease. Imagine if we control that, what are we going to get?
A lesser number, maybe.
Maybe a lesser number, you know.
All right, thanks so very much. Runcie Chidebe is Executive Director, Project Pink Blue.
Yes.
Thanks for the awareness campaign.
And
Thanks for the center and the enlightenment.
Yeah, and thanks to Arise News for all your support.
Thank you very much.